get plastic surgery?
I'll just start by saying we covered that before. Do you want me to carry on with that, or do you want me to start over again and answer the same question?
I would say over again.
Okay. I think that you had asked before about whether there was a particular age, and I think it's not so much an age determination about plastic surgery, but I would be very concerned about doing a large operation on somebody that was maybe too young to understand what the changes in their life could be, and also if they didn't understand what the surgery involves, and if they would be able to handle any complications that were to arise. We certainly don't operate on every patient that comes to see us, because you have to feel that you've got a good relationship with your patient, that they understand what you are able to produce and achieve, and make sure that they are reasonable in terms of what their expectations are. The surgery can certainly change people's life in a positive way, but it's not going to correct somebody's very poor impression of themselves, or if they have very poor self-confidence, or if they think that plastic surgery is going to help a problem with their marital relationship. That is the kind of patient that we don't want to operate on.
Okay, and so are there a lot of risk of plastic surgery?
Any operation has a potential risk. Fortunately, the risks are extremely small, and it's very important that we discuss that with patients ahead of time about what possible risks could happen. And each operation has different kinds of risks. Some have a higher risk of perhaps bleeding or infection. Some have a higher risk of perhaps a nerve injury. But it probably is fairly safe to say that almost any sort of large operation would have a potential risk. But the risks are extremely minimal and very, very few.
And do you know if there are any laws related to plastic surgery in Canada?
If there are any
laws?
Thank you. Yes, we've got a good number of laws that are responsible for maintaining how private plastic surgery hospitals or private clinics are run. We have very strict laws about who can do plastic surgery. In the past, there was not quite as many laws, and you had people that didn't have as good training that were doing plastic surgery. So they could be a family physician or a family doctor that had done a little bit of training, and they were trying to do plastic surgery. And the laws have gotten much better and much stiffer to prevent that happening.
So there are two kinds of plastic surgery, like you say, like they're like repairing surgery and birth surgery?
It probably is two major areas, one being more reconstructive and one more cosmetic. But they also blend together quite well, because the reconstructive cases, we are trying to restore someone back to normal. The cosmetic cases, we're trying to make them better than normal. And there are, I guess, surgical techniques that we've learned, both in the reconstructive side, that help us do a better job for cosmetic surgery, and probably the other way around as well.
So, in your opinion, does plastic surgery help people to feel better?
Yes, it's actually a very positive surgical specialty to work in. I've been doing it for 30 years, and I look forward to every day when I come in and do my surgery, because patients feel better, they look better, and I think we help a great deal. So yeah, it's a very good specialty to be in.
So like because it's make them feel better, like kind of people sometimes wants too much of it, like.
Those are hopefully the cases that we're not gonna operate on. We're gonna find people that, you know, we can make a positive change. I had one not too long ago. She had a breast enlargement done, and she actually worked at the hospital. About 2 months after we did the surgery, and she had a very good result and was very happy with it, she met a young man from Australia. They got engaged, they got married, they moved off to Australia. I mean, I think we really changed her life with a case like that. So, yes, there's a lot of good stories like that happen.
Okay. Thank you.